Great. Thank you very much, Steve, for that introduction, and thank you, Chime, for co-hosting this webinar. And finally, thank you to all the participants today for joining our webinar, where we're going to showcase some of the key insights and findings from Cognizant's 2023 Healthcare Provider Automation Survey. And as most of you, I'm sure, joined this, you looked at our abstract, but really just to summarize, it's our point of view that health systems and hospitals continue to focus and invest in improving health outcomes, care quality, patient experience, et cetera, while at the same time facing unprecedented competitive challenges, staffing challenges, and cost optimization challenges. Finally, automation technologies increasingly are providing hospitals and health systems with a very useful lever to drive value, improve fiscal and operational stability. And clearly, some aspects of the pandemic that we've all been working through over the past several years have also proved that there is a significant automation business case. But where do we start and how do we begin to deploy it? So we undertook this survey effort with the belief that hospital executives are interested in hearing about what's working for other organizations, how to start, or even what's the best way to continue any existing automation efforts that they have underway. So again, thank you for participating, and we'll go forward. Steve did a good introduction. I'll just add a couple of points. I am Bill Shea, of course. I've been with Cognizant in a variety of leadership roles, first joined the company in 2006, but I've got nearly 30 years focused on this industry, always in healthcare, always at that intersection of IT and business. So thrilled to walk through this content with you today. With that, I'll hand it off to Scott to see if he wants to add anything to his introduction. And Scott's also, subsequent to that, going to let all of you know how we're defining automation for the purposes of the survey. Scott?
Thanks, Bill. It's great to be here with you today. Steve did a really great job. I sit in the interesting position of being both clinician, provider, executive, and technologist. And so that allows us to together talk about this in ways that I hope will resonate with you all. So why don't we go to the next slide, and I'll spend a minute sort of setting it up. This is an automation survey. We talked to individuals and organizations that we'll talk about in a couple slides. But when we say automation, what exactly do we mean? Well, the official definition is the use of system and technologies to make processes and procedures more streamlined and efficient. And when we talk about this in the context of our business and our clients, we also include robotic and intelligent process automation and the various stacks of artificial intelligence ranging from traditional machine learning through today's all-consuming topic of generative AI. So as we move forward, I think it's important to keep this definition in mind because I think it will provide additional insights in what we learned and our commentary. Bill?
Great. Thanks, Scott. So why did we want to focus on provider automation now? And there's a variety of reasons. Some including that there is a history in health systems and hospitals as a segment where it's relatively slower to adopt new technologies and digital capabilities, particularly in those patient-facing and stakeholder-facing layers. Separately, as I mentioned before, the pandemic did accelerate a lot of investments in automation and digital self-service, and some of those are beginning to pay off, but we wanted to kind of get a sense for how that may or may not have scaled. And then also there's a variety of market dynamics at play that are changing the competitive landscape, as well as new technology advances, most recently all the hype around generative AI. But all of this is accelerating interest and investment in automation. So it seemed like a good time to begin to address this. And also an increasing sense that automation is really becoming an existential need. It's not a nice to have. In order to really optimize costs, manage some of the staffing challenges, and deliver value, hospitals and health systems really do need to become more conversant in investing in automation. And I won't talk about all these points, but there are a number of factors that are making automation of increasing interest and value to hospital stakeholders. One is the persistent labor challenges that we're seeing across both clinical and administrative staff. And burnout as well is an issue for even the largest and best capitalized players. In addition to that, we're seeing a continually increasing regulatory burden on processes, as well as just an overall administrative burden that has been characteristic of our industry for a while. But there's real opportunity around the complexity that this administrative and regulatory burden brings to our processes. And a lot of folks are hopeful that automation can be a lever to fix that. Finally, all of this process burden is deepening the financial challenges and cross pressures that all of the all of the stakeholders in this industry are facing. And again, there's a real opportunity here potentially to begin to mitigate some of those. And so the key mitigators are on this slide: disruptive technology and potentially AI. So disruptive technology includes all the automation levers and machine learning and tech and related solutions that are creating an ever-expanding set of use cases for our industry. And then artificial intelligence is a bit of a buzzword, right? There is a lot of hype there, but I think folks are really interested in identifying what are some key pragmatic use cases that I can begin to explore and pilot relative to Gen AI to begin to understand it and drive even bigger value in the future. So with that, Scott, I don't know if there's anything else you'd like to add.
I think that's well said, Bill. I'd like to hover for a minute because I think the linkage between labor and administrative burden can't be overemphasized. The pandemic taught us very clearly that our clinicians, nurses in particulars, because of their licensing structure, were very able to move around the country and did so, which left healthcare systems with existential crisis, either inadequate number of nurses or facing market conditions where salaries were practically double. And we also saw that physicians participated quite heavily in the great retirement or the great exit during the pandemic. And so decreasing administrative burden, and this I think applies both to near patient and operational and financial participants, is really very important. I too am really excited about artificial intelligence. We're highly committed to the generative AI space. And I think the opportunity is now right and directly finding those initial places to move, those problems to solve, so that we can deploy the Gen AI in ways that take good advantage of the available data and don't create additional risk. So I'll take a minute here to talk about the methodology that we used for the survey. We approached 300 hospital and health system executives, and the questions were designed to address attitudes toward and information about investment related to the use of automation and specifically generative AI. You can see by the graph that we were careful to include a broad range of organizational types and sizes because we didn't want to have market bias. And we ended up with 3 cohorts. We had 120 from the C-suite, 80 representatives from IT, and 100 business leaders in the roles that are shown and the business units that are listed below. So together, I think this puts together a pretty homogeneous picture of what's happening now geographically from a size and a risk perspective in healthcare. Bill?
Great, thanks, Scott. So why don't we focus on, we'll get to the key findings and the key takeaways from the survey. And Dr. Schell and I are going to tag team on this. So I'll lead off the next slide, and then we'll kind of rotate from there. But I think some of the findings are validate some assumptions we had as we came into this survey effort, but some were a bit surprising as well. So we want to be able to highlight both of those. But to kick things off, the first finding is that there does seem to be strong consensus across hospital and health system stakeholders that automation is an important lever, and it is a useful way to drive improvement across the various initiatives in play. And as you can see from the survey result, that over 80% of survey respondents believe that it's either an important or an urgent or even an existential requirement to be able to use this automation lever. That said, despite this agreement, there does seem to be some barriers remaining in terms of how things get prioritized, and there's 20% of folks who really aren't getting an impact. And we'll talk about some of what we believe some of those challenges are a bit later. If you look at the right-hand side, even though there's a lot of consensus about this, that the automation lever can be useful, it's interesting to see where this market segment or this industry segment is in its automation journey. So based on the survey respondents, approximately 80% are applying automation to some extent to get value, right? But it is interesting, if you look at that, it's really, even though there's 80% that are beginning to pilot or deploy automation, there's still nearly 50% of folks that haven't started, or they're just investigating, or they're just piling around one or two functions. Right, so it's interesting to see such consensus across both the C-suite, IT leaders, and business leaders that there's real value there. But it seems like there's significant opportunity to begin to accelerate the automation journey, and then there's clearly some barriers that we'll touch on as we go forward. Scott, anything to add?
Nope, I think that's well summarized, Bill. Thanks. Yeah. So the second key finding really sort of centers around the reality that providers are focusing on productivity. And the left-hand stack talks about which factors contribute to these executives' calculations, specifically around the return on investment for automation. And productivity is a clear leader, with the other categories in many respects supporting the concept of productivity as well. Perceptions around automation are also very interesting, because nearly half of the respondents landed on automation being vital to helping in workforce success. And to support that, 38% were saying that this can also help to alleviate pressure on the workforce and relieve staffing pressures. What does this mean in reality? It's not focused that the robots are going to displace the people, but what they're trying to drive is the rote, repetitive, routine activities that consume time into an automated production status. And that leaves the staff, whether they're near-patient clinicians or operations and finance folks, time to basically be either at the top of their license or at the top of their skill sets to problem solve where the rote isn't important. Bill, any follow on to this?
No, I think you've addressed it well, Scott. That's but it does sort of tee up the third finding, right? So where are the automation opportunities and the top priority areas that hospital and health system stakeholders see as ripe for automation? And it's clearly there's no shortage of priority areas, right? That the opportunities span the enterprise and the entire value chain. As you can see here, there's some belief that there's automation ROI or benefit to be achieved across all of these towers. But as we begin to look at how they all relate together, it's interesting to see that IT is far and away the function where the greatest opportunity is seen. And this isn't all that surprising, right? That it indicates that IT is, and some of the other survey questions also validate that IT tends to be the dominant champion for automation investment in the enterprise. And then as the dominant champion, starting with inside their own house and automating IT processes makes some sense, right? There's fewer barriers, there's less collaboration across IT and business and clinical leaders in order to deliver on automation investments around IT processes themselves. And it is a good place to start, right? In order to get real value out of additional investments in IT, having a rationalized, optimized, modernized IT foundation to start with is going to be important. So that is one thing to note. The other is that it was interesting to us that care management and care delivery also ranked as highly as they do in terms of being able to use automation, machine learning, advanced analytics, et cetera, to improve stakeholder experience of care, and whether that's in the context of chronic care management or just pure care delivery, there is real hope and opportunity seen there. And then you can see across the other towers, like I said, there's opportunity perceived there. I wanted to highlight one point, though. On the far right, you'll see revenue cycle as being relatively low opportunity area compared to the others. But it's also the way the survey question was asked. If you look at some of these other towers, including patient financial services, claims, scheduling, patient access, et cetera, a lot of those include subcomponents of the revenue cycle. And as different data cuts we took, where we began to put the subsegments together and build up towards the revenue cycle tower, I would say that that's also a third opportunity area that folks see and are beginning to invest in. So overall, I think there's general agreement that there is significant opportunity, but you can see that where a lot of folks are starting is inside the IT shop. Scott, anything you'd like to add?
Yeah, I mean, I appreciate the commentary about IT. I think it'll set up what we talk about in the next slide. But the nice thing about IT automation is it can be done separate from the business and financial and clinical operations. And so there's sort of less of a collaborative reach, but maybe we can drill down to it in a bit in our key finding 4 slide. So again, this sort of recapitulates what Bill just explained. 59% of functions were deployed in IT. And I think this is really very important for a number of reasons. First of all, IT infrastructures are at a sort of critical point. There's lots of legacy systems, physical, on-prem, off-prem servers array. And for much of what needs to be achieved prior to successful automation implementations, you have to have a unified digital fabric, cloud-based. And so IT organizations are making those investments now in order to drive out inefficiencies and interoperability problems, and also to predispose themselves to this sort of unified platform. It's important to know that all of this can be done really off cycle of any clinical activity. So it's not like an EMR or a financial services or a claims deployment where there are multiple stakeholders, lots of interoperability and collaboration. Oftentimes these deployments can be done overnight or during the weekends, and the users are informed about them or may have brief outage moments, but very little more as it relates to their day-to-day operations. We mentioned before about cloud migration, and again, this is really a high area of focus. This is a great time to make these migrations. The cost, outcome, reliability, security problems that we have been discussing for the past 7 or 8 years have been solved. And it allows there to be a unified, consistent, and resilient platform, not only to continue current operations, but to build upon future IT and automation and now generative AI deployments. Any additional thoughts or anything I missed on that, Bill?
I think you covered it well. I guess the one thing that I would sort of come back to is it is interesting that the executive team, senior executive team, and the business leaders aren't, I don't know if appreciative is the word, but aren't well aware of all of the efforts IT is making. And I think it does, we'll sort of come to it when we get to recommendations, but it does sort of beg the need for having a comprehensive communication strategy. And I do think, best-in-class companies are getting sort of best-in-class results from automation are having to address that IT and business clinical collaboration, right? And in order to get automation value outside of the IT organization, I think you need to have the right governance structure in place, the right communication strategy, and change management efforts. But it is interesting to me that IT is that a lot of this is just sort of going on underneath the radar, and I think it may be related to the prior slide where a lot of this automation activity is actually around automating IT or cloud processes.
Right.
So key finding 5, right? There doesn't appear to be a shortage of champions, right? The executive layer, the business leaders, and the IT leaders all see themselves as champions of automation. But even as I look at that, it still seems to be there's some agreement that IT is the dominant champion. Certainly, if you look at that middle column, IT respondents certainly felt that they were the primary champions. The C-level folks felt that the C-suite was the primary champion, but the second, dominant champion in their view was IT as well. And the business leaders, the highest percentage was 43%. So IT is the dominant champion. So it is clearly being driven by IT. It's nice to see on the business leaders that there is some distribution of leaders across administrative, clinical, and research functions, as well as in the operational business units. But I think this also goes back, I think an important takeaway here is that in order to get through some of these organizational barriers or sort of business versus IT silos, is that we do need to get to a governance model or a center of excellence model that is actually incorporating business leaders more directly in the automation efforts, right? And I think that particularly for this segment, hospitals and health systems, there's missed opportunity on the business and clinical side and the patient-facing side to drive more value. Scott, I don't know if there's anything you'd like to add.
Yeah, so just a quick comment, having spent the last 3 decades inside these systems, I'm relieved to see that finally the Luddites, the naysayers are gone. No one is saying I'm not in favor, or practically no one is saying I'm not in favor of automation. And this, I think, is a significant change. If you go back to HIPAA 1 and 2 and the EMR rollouts, the decision support tools, the value-based care implementations, there was always double-digit and not infrequently significant double-digit opposition to this in each of these silos. And I'm glad to see now that we're all recognizing, and I think it underlies what we talked about earlier, that automation really is an existential asset. It's no longer a nice to have. And that finally the organizations have either put the leadership and change management controls into place so that everybody is now rowing at the same cadence, or that the people who are naysayers or blockers have either left the organizations or have left the organizations, if you know what I'm saying. So I think that's really an encouragement for me. We can go on to next. Yeah. So it's interesting because we spent time and we really dug into analyzing the sources of resistance from a perception and a practicality perspective. I think we need to go one earlier, please, Bill. There we go. So the left stack says, what are the top 3 rank order difficulties that are preventing you from getting funding to drive your automation projects? Worries about patients not accepting automation. We can talk about that some more. Employees not wanting to adapt or learn new skills. I think that's just a reflection of what I call the EMR drudgery. And then internal partners resisting automation, either because they have a perception around that their roles are going to be disrupted or eliminated. And it comes back to the efficiency and productivity issues. And so it turns out that the lever here is funding blockage. The other 4, public perceptions, lack of IT resources, insufficient training, and leadership understanding, I think are less important, but I think we'll talk more in a bit about IT resources. But as these organizations said, oh, well, let's focus now on the automation projects that are currently underway, what are the top 3 barriers? Well, number 1, insufficient IT talent. Number 2, data handling concerns. And number 3, out-of-date infrastructure. And this harkens back to what we were talking about in some of the earlier findings about legacy systems, many systems, physical systems, and the migration to the cloud and a unified digital fabric, using my terms. I think it's quite amusing that patient resistance and physician-clinician resistance, which were key drivers in the can't get funding perspective, dropped to the bottom here. And I think it's also worth calling out, again, the issue about change management. I think executive leadership needs to be thinking strategically, okay, how am I going to resource my IT assets and my personnel in order to drive this forward? Because this is going to be a blockade. And for the rest of the stack, how am I going to lead from a pardon me, change management perspective so that we get people harmoniously around a common goal and avoid obstructions. Bill?
Yeah, no, I'd agree with that. And I did find the sort of the top 3 or 4 findings here to be telling. I think it highlights the importance of identifying the right partners, right? As you go through this, you're going to need need to partner with organizations that have the right IT talent. And I don't think any single health system or hospital is going to have the level of automation and AI expertise to go it alone or to get as much value if they do. So I think finding the right IT partners and advisory partners to really drive, to bring a strategy layer to your efforts and a governance layer is going to be important. And if I look at the second and third, right, the data handling and the infrastructure, you touched on it, Scott, but I kind of go back to in order to get real value out of these kinds of investments, you need some to look at the data and IT foundation, right? You need a digital ready IT backbone. If you're going to begin to apply automation as a band-aid to sort of mask the fact that you've got some redundant, unmodernized systems in the back end, then I think you're going to have a fairly brittle bot layer. You're going to have increased maintenance costs each time you have a release or an upgrade of some enterprise system here and there in the back end. You're going to have to unwind some of your automation investments and what have you. So it highlights the importance, I think, of making sure you've done some pre-investment in rationalization and modernization of IT and data assets, but that you also don't approach this in a piecemeal way. You really have to think of this automation layer, you know, whether it's IPA, RPA, machine learning, or whatever, as a layer within your overall IT architecture, and you approach it in a systematic way as you think through what to prioritize and what not. So that's kind of what jumped out at me, is that those barriers, those are real, right? But they come to being sort of digital ready, automation ready in the back end, bringing the right talent layer to the effort.
Yeah, the day of the disposable bot is very happily dead.
Yeah.
Yeah.
All right. So the survey respondents confirm that where they've made automation efforts, it has been worth the effort and it's had a positive impact on overall business value. You know, approximately, well, if you look at the data, nearly well, actually over 2/3 of respondents saw a benefit. They thought their automation efforts were either a benefit or they exceeded and met expectations overall. You know, of those, over 2/3 felt that the investments were well worth it. So that said, though, if you sort of cut the data a different way, there's still about 1/3 of folks that have stalled, right? And their automation initiatives, they believe, actually may have made things worse. And that, you know, it goes back to, if you do this piecemeal, it can lead to increased complexity and increased maintenance cost and more throwaway bots and things like that. And I think that highlights the importance of taking a systematic and incremental and governance-based approach to these kind of efforts. We have, you know, I sometimes use the term automation 1.0 versus automation 2.0, and a lot of my clients went down this automation path early on and didn't take a particularly well-governed approach. There were various pilots in automation and even a whole variety of automation tools inside the same enterprise that were creating a very complex ecosystem that actually inhibited value and increased costs. But I do think a lot of, you know, the industry overall has taken some real lessons learned there and appreciate the importance of leveraging this important lever that can have a significant impact, but making sure they do it in the context of a well-governed sort of IT business collaborative model. Scott, anything you'd like to add?
Yeah, the ROI concerns always sort of stand out to me. And we know from our experience that they tend to be amplified earlier on in automation rollouts, but they really shouldn't be, in my mind, a barrier to, you know, sort of putting on your cleats and getting on with it.
Great.
Yeah, so generative AI. Generative AI is, not a cause celeb. I think it's a society and industry transforming reality. Over the weekend, I was walking through my local big box stores and was pleased to learn that artificial intelligence is now in the vacuum cleaner, in my toothbrush, and apparently also in the oil that I put into my car, which I guess may change what I talk about when I'm driving around if it's listening. We're really excited about artificial intelligence and very heavily investing in time, technology, and products. And Key Finding 8, I think, generated a lot of excitement amongst our respondents. On the left side, how are you currently using generative AI? Research purposes topped out at 40%, individual repetitive task communication, eliminate tasks, validating work, et cetera, et cetera. As we talk with our partners in healthcare, and as I work with the leaders that I am directly connected with, these are very early times, and I think people are very appropriately taking measured, careful steps because they want to make sure that the data inputs that they're using in their generative AI models, whether they're public-facing or institution-specific large language models, are accurate and harmonized. Obviously, concerns around accuracy, patient confidentiality, and making the right decision are very, very important. On the right-hand side, we asked, well, what are the top 3 areas that you, as executive leaders, think would benefit from generative AI? And care management came out at the top. IT is low-hanging fruit, and you can see the rest of the stack. But this finding actually comes back to the earlier portion of our talk today, where care management and care delivery were key areas of drivers. And so not only are these key areas, but I think our leaders are very excited about driving towards solving and lessening the administrative burden and improving the outcomes in these key technology areas. And as I said, we're very, very excited about the area and are making key investments in this tech stack. And we're actually rolling out today. In fact, we're engaging with one of our partners for a generative AI tool that will directly interface with how patients access care. I'll throw out a caveat, though, because as we talk to our colleagues and partners, but also go to the national, international conferences where this is really dominating the conversation, institutions are very concerned about the quality, integrity of their data. And they're talking about health information data, particularly focused around EMR, but also claims and financial data. There's been a lot of copy and paste in EMRs, and that sort of degrades the quality of the data. And so leading healthcare institutions are now making big investments in rehabilitating those data so that as they train large language models, the data going in doesn't introduce biases or, AI schizophrenia is the term today. And that's all driving towards the focus on accuracy and integrity and confidentiality. But I don't think that this is at all stopping the progress, but we're identifying those areas that we'll need to solve up in order to have the right platform for the AI to run. And it's basically data and infrastructure because it's data consumptive and processor time consumptive. Bill, did I miss anything on this part of the findings?
No, but I thought it was interesting. We all know this is an emerging technology. It's a very nascent. Scott, to your point, a lot of the industry forums and our conversations with our client base indicate that folks are just, that they aren't well down the path, right? They're really looking at this new technology and trying to identify some pragmatic near-term use cases that they could begin to pilot so that they become conversant with Gen AI and large language models and its potential. And I think, like with any new technology and any new potentially disruptive and powerful technology, that makes sense. Start piloting early, identify some near-term use cases that are clearly measurable, and begin to understand the potential around this technology. If you look at I've got a chuckle out of, I use it for research purposes, 40%, because I don't think 40% of any part of the hospital and health system universe is actually using Gen AI, but this does indicate that 40% of them have maybe downloaded ChatGPT and asked a few questions, right? And also using it to craft communications, which was the third. Now, already, this technology has proven itself useful in terms of drafting communications and briefs like that. But again, I wouldn't want the audience to look at some of these percentages and think, wow, there's a lot going on. It's really a lot of interest and experimentation. And what I thought was interesting about the right-hand side, about the areas that could benefit from Gen AI, it kind of proves that it's really the same set of problems that we're going to apply a new tool or a new capability to, right? So the generative AI doesn't change my sort of various problem statements. This is the same set of priority areas that we saw for automation, and I would argue even for some aspects of digital transformation and what have you. So there's just a hope that this new technology will prove even more effective in solving some of the same old challenges and problems that the industry has been facing off against. And I think it will, right? But I think it's not going to do it immediately. But that said, I think this indicates that all the key stakeholders are aware of no one's denying that there's real potential here, right? And I do see this as beginning to be on everybody's roadmaps, whether it's pilots or proof of concepts or MVPs or what have you. So where does that lead us, right? So in terms of some recommendations that we have coming out of this, first of all, we've touched on it already, but I think the importance of finding the right vendors, the right partners, both on the IT side as well, or conversant on both IT and business, in order to make this successful. And you've got to be able to leverage a fairly robust IT talent pool and also tap into automation and AI experience, which I think for most hospitals and health systems, that's going to require partnership. In addition, I think the right partner can help you establish an automation strategy, an automation governance layer, and a good way to start off with that is creating an automation center of excellence. It's going to be important, and I kind of mentioned on this before, but I think you need consistency around the automation tools that you're leveraging at the enterprise. You also need to have an organization that brings a consistent framework, a consistent ROI methodology, and a sort of infrastructure where you can begin to pilot and deploy and measure these things. So I think a COE approach is in many ways a best-in-class approach, at least when I think of what I refer to as Automation 2.0. Establishing a strong strategic governance. We touched on this a lot today, but I don't think we in the hospital and health system sector can really get the value out of this unless we have a framework for collaborating between IT, business, and clinical leaders. And creating that strategic governance layer that, again, harnesses the value at the enterprise level and creates a consistent prioritization framework. And some examples of why that's important, and we may have referenced some of them here, but it is going to be, if you don't take a strategic governance approach and take a look at the automation opportunities that are going to exist already inside of your enterprise platforms and each of their roadmaps, right? So all the big platform players in our industry are building new functionality, leveraging automation, leveraging AI into the enterprise platforms that all of us and you use. And so investing in a lot of automation point solutions that may just become obsolete upon the next release or need to be unwound and sort of edited each time you do that kind of intelligence is going to be important as you go through the automation effort. And you don't want to increase complexity. You got to do this in a way that actually drives value and improves and simplifies processes, at least for the end users. It's also going to be important to identify the near-term opportunities or low-hanging fruit for initial efforts. What is your ROI methodology going to be? There's a lot of folks who made investments in automation and don't know actually if they're getting an ROI. So I think finding the right use case and then and working through that in a consistent and systematic way to make sure that you're getting some value is important. The understanding the impact on stakeholder experience. I think you need to understand and plan for the impact on stakeholder experience. We've seen from some of the survey data that we've covered already that some of the fears around patient or end user resistance or provider resistance to automation doesn't seem to be as dominant a factor as folks thought, right? So when we do automate things, when we do increase self-service, the experience of that investment tends to be positive on the part of key stakeholders. So we need to understand that. But there are resistors, right? And so I don't think you can get there without planning for change management. There are, in particular, even the data we reviewed today does seem to indicate that the fears of automation, either increasing complexity or impacting individual roles, tends to be more on the business side of things, right? So beginning to let that organization understand that automation can actually benefit them, increase their productivity, augment their capabilities, and begin to improve their overall experience of work generally is important, right? So I think change management needs to be part of that strong governance that I've talked about previously. And then a comprehensive communication plan. Folks need to understand why you're doing it. And like we saw earlier on, a whole lot of investment and effort in automating activities in IT that the rest of the organization isn't appreciative or isn't aware of, doesn't help build the business case for expanding IT efforts into other parts of the organization outside of IT. So I think focusing on that comprehensive communication plan informed by a robust change management strategy is going to be critical. And then it's not on here, but I personally have talked about it quite a bit today, but I think aligning to your overall IT strategy, your overall IT and data rationalization and modernization strategy, and sequencing your automation investments into that strategy are going to be important. I don't think automation should be a leverage that just folks handle independent of the broader strategy inside of IT and frankly inside of the enterprise. Scott, things you'd like to add?
Yeah, I mean, I think you summarized it exceptionally well, Bill. For me, this is the highest art form of change management, front and center. As soon as you step, in my opinion, outside of the boundaries of IT-only automation into the business or clinical operation units, it's all about having the key business owners and the stakeholders embracing the concept of change management. And I couldn't possibly more strongly agree with your comment that strong strategic governance is the unifying principle that we see in organizations that do this successfully. Those key stakeholders are around the table. The rules are understood. Part of automation transformation includes a very clear-eyed consideration of keep, discard, and replace. And that involves digital assets, IT assets, and it also includes processes and behaviors in clinical operations as well. So if the rules are well defined and the stakeholders are around the table, then they automatically become your champions in the relevant business units and drive towards excellence. And then, change management ultimately is all about clear, consistent, and accurate communication. Doctors and nurses are very concerned and incredibly passionate about providing the very best care to their patients. But they also feel like they've been overburdened with a lot of these administrative tasks and so forth. So in my experience, it's essential to communicate with these individuals, not uniquely, but I think they have a unique perspective that, look, we're doing these things and the end result will be two. Number one, you'll be more effective at providing better care to the people whose lives are entrusted to you. And number two, you'll spend less time with your back turned to them hammering on the keyboard. And I think those are important issues.
Right. Thanks, Scott. Steve had mentioned at the beginning that we're gonna try to leave about 15 minutes for Q&A, so we're a little bit past that mark, but we certainly want to hear from you and have an opportunity to answer some of your questions. But before I go there, I also wanted to mention that, and Steve may have at the beginning, but that we will be following up this webinar with a white paper that takes a deeper view and a more comprehensive view of some of the responses that we've got. You know, so it's a rich data set, and it's hard to touch on all of it in a 1-hour webinar, but keep your eyes open for that follow-up piece of thought leadership.